At Grossmont Hospital in La Mesa, the fight to reduce hospital-related infections starts here, in the region's busiest emergency room. 3 out of 4 people who are admitted to Grossmont come in through the ER. They're usually the sickest patients and the ones who are the most vulnerable to infection. That's why the ER is ground zero in Grossmont's fight to battle sepsis. Sepsis is a life-threatening condition that occurs when bacteria overwhelm the body's immune system. ER Dr. Julie Phillips says septic patients are in danger.
They need aggressive therapy, they need it quickly, they need it initiated immediately when they come into the ER, and those are the patients that we're trying to pick up as quickly as possible when they arrive here.
Having heart problems, my heart rate was really high.
The identification of sepsis begins when a triage nurse assesses the patient. The diagnosis is made inside the ER at the patient's bedside. Thanks to a high-tech device, doctors don't have to send blood samples up to the lab and wait for results.
For this particular machine, the turnaround time is a minute because it's here at the bedside, and so what happens is if I get a septic patient who comes in, I suspect sepsis, but I'm not really sure, I can get this machine and the data done within 1 minute of the patient's blood draw, and I have all my data immediately.
Once sepsis is confirmed, patients immediately get an IV that delivers antibiotics and fluids.
When we get a protocol and a set plan in how we're going to treat these patients and everyone abides by it, we save lives.
Sharp Grossmont is just one of many San Diego hospitals that's taking part in the campaign to reduce infections. 160 hospitals are involved statewide. The effort is necessary to reduce a problem that many believe has gotten out of hand. About 1 in 20 Americans who are hospitalized get an infection while they're in the hospital. In fact, hospital-acquired infections are among the 10 leading causes of death. The push to reduce infections is crucial inside Grossmont's surgical intensive care unit. Here, patients are frequently hooked up to IVs and ventilators. These are ideal ports of entry for harmful bacteria. That's why doctors and nurses follow a strict protocol when they interact with patients. Nurse Emily Garcia thoroughly washes her hands before she touches a patient. Then, as she prepares to change a dressing, she performs a series of other steps to minimize the risk of infection.
In here I have what we call a chlorhexidine swab, which I end up scrubbing around the whole site for 30 seconds.
Next, Garcia puts a chemically treated patch around the catheter to prevent microbes from entering the line. Finally, she places a fresh dressing on the site. It's large enough to keep the patient's saliva from dripping onto it.
Another thing that we do to prevent even ventilator-associated pneumonia is we actually always have the head of the bed 30 degrees.
Garcia says these routines are critical to good patient care.
What if they were our loved ones? What if it was your mom, your dad, your brother, your sister? We wouldn't want to cause any harm to them. So we consider each person that comes in here like a family member.
Dr. Barzan Mohidin says he's convinced if all hospitals did what Grossmont is doing, hospital-associated infections would be a thing of the past.
If we all implement an evidence-based medicine, which is going to prevent hospital-acquired infection, I am sure that we will be able to achieve the goal that we want, which is zero infection.